Okay, I'm going to try this again. I have had problem after problem this morning trying to record this video, and I think I've finally got everything settled down. But anyway, today is the 4th day that I am using prescription Cannimed. It's 1 to 20 CBD oil. That means 1 unit of THC to 20 units of CBD. And I've had absolutely no psychotropic effects from it, no high. I've actually had no negative side effects whatsoever. I've dealt with daily chronic pain since December 15th, 2010, so 7.5 years now, 6.5 of which I've used no prescription pain medicine due to negative side effects from both opioids and NSAIDs. So it's been great to try a new treatment that has not resulted in any negative side effects as of yet, and hopefully not ever. I took the 5th dose yesterday around 11 a.m. I ended up going and seeing my chiropractor in between my 1st and 2nd dose. My 2nd dose I took around 11 p.m. yesterday. I did go see my chiropractor. That's something that I had shared that I wanted to discuss because a friend of mine was like, oh my God, I can't believe you go see a chiropractor and you're in pain. And she deals with her own pain experience as well. And I had shared with her that not all chiropractors practice the same and that mine is excellent in regards to gentle therapy. My chiropractor, she trained out of Canada. She is excellent in regards to individualized treatment plans. She has shared with me in the past that she has to be much more gentle with me compared to the majority of her other patients. She does myofascial work on my body. She works to increase blood flow to affected regions, which then aids the body in natural healing. And she also does, at the end of most treatments, she does electrical therapy most of the time on my upper back because that ends up resulting in pain that radiates up into my head that results in debilitating headaches. And I've noticed that it is temporarily effective and I get relief from it. And yesterday she shared with me that the effectiveness has been shown to be 6 to 8 hours after the treatment. So that fits with what I've experienced before, understanding that from her. She did allow me to video record our entire session, and unfortunately, where she's employed, they would not allow me to use videos or photographs from inside their facility. And for me as a doctor and as an educator, that was very disappointing because I look at it as a missed opportunity to help educate and show people what I am going through, but it's largely outside of my control, and I respect my chiropractor and I don't obviously want her employment to be affected. So I ended up deleting that video. So another question that I got this morning is it legal? And yes, this is prescription, so medical cannabis is legal here in Grand Cayman, at least in the oil form. And my current pain specialist, she's from Barbados. She trained in Jamaica and then she finished her pain training in Canada. She and my Canadian trained chiropractor both shared with me that all forms of medical cannabis have been legal in Canada since 2001. And I was actually just recently talking to a friend of mine who I met living here who moved back to Canada, and she's now currently taking CBD oil, and she's been taking it for 3 weeks now and it's been going well for her. I don't know the brand or the mixture that she's using, but I learned that by sharing my own experience with it. I also looked online because I was interested in seeing where it's legal in the US, which is where I'm from originally. And I was amazed to see how many states already have it legal for both recreational and medical use. So I will share that link that I found in the description of this video when we finish up. I talked about wanting to share about my pain, my actual pain, and the quality of my pain, what makes it better and worse. And I was talking to my husband, I was like, should I put all of it into one video or should I break it up based on region? And he felt that breaking it up based on region would make it more digestible because I have hand pain, I have pain in my upper back, which is affecting me a little bit more today, and that tends to radiate up into my head, and it can put me in bed with debilitating headaches. I have lower back pain, which is pretty much at the area of, you think of how you're sitting in a car, and it's like where the force went into my back, because the semi-truck hit me initially from behind, and then my car turned, and the second hit that I remember, he was initially coming towards my driver's side door. My car continued to spin, he hit me near my gas tank, the second point of impact. And then it appears that there were 2 more points of impact, but I don't recall how that happened. I just noticed it from the photos. It doesn't all add up based on what I remember. Because then what I do remember is facing oncoming traffic. The butt end of the truck was blocking the front of my car, and I just kept seeing cars go around me. And I was expecting that I would end up getting hit head on. So in addition to my hand pain, my upper back, neck and head pain, and my lower back pain, I also get sciatic pain that goes down my left leg, which leaves my lower left leg feeling heavy, and then I tend to get issues into the outer left 3 toes of my left foot. So today I want to talk about my hand pain. And even before my accident, I dealt with issues with my hand. As a little girl, when I would write, my hand would get really sore, but I just thought it was normal. And I played violin for most of my life. I ended up playing semi-professionally before I ended up stepping away from it. And playing for too long would make my hand hurt, and my fingers pressing on the strings would make my hand hurt, but I just thought it was normal. And then when I was in medical school, part of being an osteopathic doctor is you learn osteopathic manipulative medicine, and you're using your hands to treat your patient. And now a lot of MDs are actually going to DO colleges to do fellowships and continued training so that they can learn manipulative medicine because it's effective. And as a patient, I have seen just how important the use of hands are, especially for pain patients. It makes a difference for me. My chiropractic treatments, the fact that she is aware of how to do myofascial techniques, that has proven effective for me. And I'm the type of person, if it's not effective, I'm not going to waste my time or their time, time, energy, money, any of those resources just to not see any benefit from it. My rehabilitation doctor that I saw here, who's also Canadian trained, before she was a PM&R doctor, physical medicine and rehabilitation, she was also a chiropractor. And in my appointment with her, she did just small, gentle joint manipulation in the joints of my hands and through my back, and that felt so good on my body. So it helps to have providers who have that knowledge, and unfortunately not all DOs practice osteopathic manipulative medicine, and I think that's kind of a disservice to our profession. I think more emphasis should be used in regards to using that skill set that we're taught. In osteopathic school, we do more neuromusculoskeletal training than what they do in the MD allopathic school. Otherwise, our trainings pretty much identical. My first 2 years of medical school, well, first year especially, all my classes were shared with MD students at Michigan State. So and then I was matched into an MD physical medicine and rehabilitation residency. That's what I would be doing right now personally had I not had my accident. So there's a little bit of irony, sad, frustrating irony in that fact, but God had a different plan for me apparently. So one thing I realized as a medical student, we do rib raising techniques, and you would use it for, say, a patient with COPD, and a lot of times you deal with patients who have issues with obesity as well. And what you do is you put your hands up underneath the patient, under their ribs, and it's used to end up, the point of it is to increase breathing capacity. And my hands would hurt so bad, but nobody else would complain about it. And so I just thought it was normal, but my hands would just ache. So that was another time that I had noticed issues with my hands. Then I had my accident. I went to my first physical therapist, and he was like, Nicole, I don't know why you're not getting better. And for me, that was really disheartening, and it put me in tears, because I'm like, if you don't know why I'm not getting better, and you're a physical therapist, and you deal with patients like this, you know, and I'm doing everything in my power to try to get better, I'm not getting better. It was just so frustrating. But my orthopedic surgeon ended up sending me to Stan Guest, who I believe his office is Sterling Heights, Michigan, but he actually had a whole family come in, and he treated them all, and they had Ehlers-Danlos hypermobility. And so he recognized it in me. He was the first person to give me the key to fit all the pieces together that I had dealt with in my life, other issues that fit together once I understood this. He gave me a book written by Dr. Tinkle, and it's short, succinct little book, and I was like, oh my God, all of the issues that I had contended with growing up now made sense. It all fit together. And it's a genetic condition, and you have a 50-50 chance of passing it down to your children. And I see hypermobility in both of my little ones, and hopefully they won't have negative issues with it as I have. My issues really worsened after my accident. I didn't have issues with pain, extensive pain, until I had my accident. So one thing that I noticed when I was pregnant, I thought it was pregnancy-induced carpal tunnel, but my hands just continued to get worse and worse. It got to the point where I was unable to open a bottle of water, and then it progressed to the point of it was difficult for me to open spaghetti cans, and difficult for me to open doors some days because my hands were so painful. And opening buttons became very difficult. So my hands, I think the best way to explain them, they always ache, and they feel like rubber bands that are like old rubber bands that are hard to stretch, but they're hypermobile still. It's a very interesting feeling. So my hands have been definitely problematic for me. And last year I wrote a book about my experiences up until the point that I finished that particular book, which has not been published yet. And I had to take breaks through writing that book, and it's like a double-edged sword for me, because it's very therapeutic for me to write and type and express myself in that way, but then I suffer for it. And people are like, you should get a voice activated system where you can write. But there's, like I said, there's something therapeutic also about writing, but then I suffer. And my chiropractor was like, you know, Nicole, don't overdo it. You need to give your body a break, because I get pain from my hands all the way up into my forearms, and to the point where I couldn't use them because they were so painful. And I listened to her advice, but I'm also the type of person that if I feel good, I'll overdo it. And it's part of who I am. You know, becoming a doctor wasn't easy. When I was a personal trainer, I trained for figure competitions, and I lifted heavy weights, and it felt so good. Stuff I can't do currently, and really isn't the best for somebody with Ehlers-Danlos to begin with. Oh, growing up too, I was a figure skater, and I could do like spread eagles, which not everybody can do, but it came down to the hypermobility. So all of that now fits together. And with Ehlers-Danlos, you also have poor healing is more difficult. So that has complicated my healing from after being hit by that semi-truck. I'm trying to think of if there's anything else that... I think that pretty much sums up what I deal with my hands. Feels good to put heat on them. Rest helps them. Overuse hurts more. massage feels good. Applying pressure to my hands, that feels good, but it has to be from someone else. Otherwise, it does me more harm than good to rub my own hands. So I think that pretty much sums up the region of pain that I deal with in my hands. And my next video, I will talk more about the quality of pain that I experience in my upper back, which is actually bothering me pretty bad right now, which then ends up going into my head. And so on my CBD oil, it says that I'm able to, I started at 0.5 milliliters twice a day, and it says that I can increase based on the effect another 0.5 milliliters, and I'm going to try that today. I don't want to go through all of my oil because I have to make sure that they have the remaining quantity that was on this prescription, and I know that supplies are limited here in Grand Cayman, so part of me is hesitant to increase the dose, but I'd like to see if I get more relief by using what I'm allowed to use. So today I am going to, oops, uh-oh, the dropper got stuck. Today I'm going to use 1 milliliter in the morning and see if that provides any additional benefits. So far, up until day 4, I have noticed that I have, like I shared yesterday, I have more motivation to go out at night, which is normally by late morning, I'm exhausted and I want to lay down with my little girl. And I sit a lot through the day and I can't just go. I have to take a lot of breaks, and that's frustrating. But I've been noticing since I started taking the CBD oil, I'm more motivated to go out at night. And I still have interrupted sleep. I talked about how my sleep has been affected on a previous video. But I feel like I'm getting better sleep quality despite it still being interrupted. So I'm going to do 1 milliliter today, and you put it under your tongue. And let it absorb. Oh, I gotta get used to taking more of that, but it's been easier to administer compared to the first time that I tried that. But I think maybe I will break that up still, just because of the quantity of the oil underneath my tongue, so it absorbs better. I think I'm still gonna, even if I take the full 1 milliliter, I think I'm gonna still break that up into 2.5 milliliters and then take it back to back, because that was a lot of oil underneath my tongue. So anyway, I will be back tomorrow to continue this journey and to share more about my pain experiences in hopes that it's going to end up helping other people. So I hope you have a great day. See you later. Bye.